Hey guys, 2019, this is our first Facebook Live at Medical Fitness and Wellness Group. I'm Mike Hardy with Medical Fitness and Wellness. I'm the owner here, and I've got my team of specialists, experts, specialize in corrective exercise, massage therapy, chiropractic, or complete wellness. Introduce ourselves real quick.
I'm Sam. I'm an exercise physiologist here at Medical Fitness and Wellness Group. I handle a lot of the personal training for weight loss and some corrective exercise sessions.
And I'm Cassandra. I'm the stretch and the massage therapist.
And I'm Dr. Dan Lambert, the chiropractor here in Johns Creek.
And we have a unique blend of what we do here. So, we do chiropractic, we do corrective exercise, massage therapy. We combine them all together for a unique experience, which will give you that much better results. One of the topics we want to cover today, unless you guys have questions, is shoulder rehab. And I'm going to have Dr. Lambert here in a minute talk a little bit about the shoulder. Then we're going to show you some stretches you can do for the shoulder, as well as some rehab exercises on our Redcord system.
Okay, great. So, I'm supposing some of you out there might have had issues with your shoulder in the past. There are really only about 5 or 6 different conditions that I would consider to be related to the shoulder. And unfortunately, a lot of these outside of this office, in my opinion, get misdiagnosed at times. So, the classic injuries to the shoulder are a separated shoulder, which is actually your clavicle or collarbone coming into the shoulder joint. You've also probably heard of a shoulder dislocation, where the head of the humerus, the upper arm bone, actually comes forward and then sometimes out of the socket. You can also have a tear in the ligament that traps the bicep tendon over the top of the shoulder here, in which case you'd have localized pain there. And then some of you who've been to your medical doctor for shoulder problems have gone on to have MRIs done. So you've probably also heard of torn rotator cuff, which is typically the supraspinatus muscle that travels over the top of the shoulder, or more recently, and what we see the most of here, is a finding of a torn labrum. Now, labrum is the cartilage inside the joint that actually the head of the humerus rests inside. And as there's a lip of cartilage, cartilage has a lot of pain receptors in it, so if that were to be torn, that could be a painful condition. What we see, what I see as a chiropractor, however, is people come in with a complaint of just general shoulder pain or tightness, and a lot of times they've thought somewhere else along the way that they have one of these other things. But if you're just a layperson, if you're not playing football, if you're not a tennis star, it's not very likely that some of these other things I mentioned are the actual cause of your neck and shoulder pain. If you're just having more of a tightness, tension, end of the workday issues with your neck and shoulder, we find here very often that it is related to either the alignment of your spine or just your posture. And we're real big on posture here. And these are the kind of things that we work to correct. So as a chiropractor, I'm checking the alignment. That includes your lower neck and your shoulder joint as well. A lot of times that misalignment or that shoulder dislocation is actually just the humerus being a little bit out of place. And that's something that I can correct for you. That pain will be right out here in front of the shoulder. So if that sounds familiar, then it's probably something that we need to talk to. What we want to go over next is just some of the treatments that we do. So again, I'm working on alignment. We also offer Redcord therapy. I believe we're one of just 2 facilities in North Georgia to offer this. The great thing about the therapy with the Redcord is it allows Mike and Sam to isolate those muscles. So when you hear rotator cuff, there's actually 4 muscles that travel from the shoulder blade out to the arm. The Redcord with the bungee, pulley, and harness system allows them to isolate the muscle that's the problem. And that's difficult in other types of therapies because you might want to be working on something with your arm and shoulder and you're doing weights and exercises and you're not able to isolate the supraspinatus or the teres minor, wherever that issue might be coming from. And they're going to do a little demonstration for you here in a second that gives you an idea of how that can, in some cases, take away gravity and put emphasis on those smaller muscles that are the most important to work in that case. Okay? And then Cassandra's going to go over, Cassandra's also a stretch therapist, and work on some of if some of you have probably had issues with, you've heard frozen shoulder, just working on getting some movement of those structures. Our belief is that these structures become tight and fixated because you have these other things going on. And it's not enough just to know that you have frozen shoulder. And sometimes the typical package of physical therapy isn't designed for that type of condition. And then again, with here we're working on alignment and actually working on loosening those structures in a very specific way to get that to function better for you. Okay? Let's see if we, I don't have my glasses on. We've got a couple people watching. If you have questions, obviously, it's how Facebook Live works. If you have questions in particular and you want to comment below or just kind of shoot us a little message as we go, we'd be glad to take care of that. I'm going to try and not run on for an hour and a half, as is my MO, and just keep it to a few minutes. And just give you a chance to see some of these therapies in action. If you have these kind of issues, and again, you're not a baseball player, you're not a football player, but you've been told that you have strained a muscle or sprained a ligament or have one of these syndrome conditions and you just haven't gotten a good explanation for what's going on, why don't you give us a chance? We always offer a 30-minute free consultation. That can be with one or all of us. It's always available. Hopefully our number's there on the site as well. You can always give us a call and set that up, and we'd really like to help you out. A lot of these conditions, and for those of you who don't have any experience with this type of care, a lot of these conditions are very simply explained, and working on alignment, muscle symmetry, and just getting some of those tight spots worked out end up being your answer. Okay? So, who wants to go first? And I'll kind of monitor questions in the background. Our setup isn't ideal on day one. We've got the camera over here, and then the actual monitoring questions over here. So I'll kind of I'm going to crank up the 80s tunes a little bit, because that's all we play here. And we'll let, I might go ahead and give you a demonstration on the Redcord, and then Cassandra and Sam working on some stretch and other exercise techniques to help you with those conditions. All right?
Thanks, Dr. Lambert. That was great. So like I had mentioned, it's a 3-step protocol that we do for corrective. And the first step is going to be a myofascial release, a stretching, getting the muscle back to the right length tension relationship. So we're going to have Cassandra in a minute come in here. We're going to get our client Lori, who's been with us almost four and a half years now. So she's doing really well. Occasionally she might have some shoulder issues, so we're going to show you a little demo on that in just a second. We're going to go ahead and move the camera, and Cassandra's going to come in here. We're going to get Lori on the table for you.
Hey guys, I'm Cassandra. I'm your stretch and massage therapist here at Medical Fitness and Wellness. I'm going to start opening up the joint capsule first with Lori. That way we get everything loose. I can get into the muscles and the structures a little more easily. All right, we're going to make sure she's rested here. Take some deep breaths for me. And we're going to work together on this. It's not myself working on Lori. I'm going to work with her breath, with her tension. And we're going to open this joint capsule together. We'll go through a series of relaxing movements and undulations, circumductions. And while I'm doing that, I'm pulling on the tension of her arm, creating some traction there, to give some more space within that structure. So it's more free moving, more mobility, less tension. And you can see it's very relaxing for both of us. If you guys have any questions, I encourage you to type them in, and we'll go ahead and answer them live while you're here with us. Dr. Lambert, if you want to read those.
So, of course, on day one, we are happy just to have friends and families watching, but of course, we want this to get bigger and bigger each week. And we got a question from Ivy, who is my wife, and she asked, because she knows this is something I'm going to want to talk about, if you've already had rotator cuff surgery, do these types of therapies help? Well, the answer to that is yes, and that's why we're here. Most of our clients, most of Mike's clients in particular, have already had the surgeries. They've already been to see their other doctor. They've had the diagnosis of rotator cuff tear or torn labrum or muscle strain or what have you. And again, to us, it just comes down to, is it moving? Is the muscle strength symmetry on both sides good? And in my case, is the spine in alignment? Is the shoulder in alignment? So when you've gone the other path and you've been to see your regular doctor about your shoulder problem, you have to remember what office you're in. I tell this to my patients all the time. If you're at a chiropractic office, the answer to your problem is going to be alignment, because that's what I do, and I want to help you. So my diagnosis and treatment plan is going to be centered around those types of things. When you go to your medical doctor and your shoulder hurts, and they can't do anything for the pain initially, the MRI becomes the next step. And then you have an MRI done of your shoulder, and now you have a radiologist picking and choosing where these anomalies are. And I just find, quite frankly, that people who have shoulder pain and problems and are, once again, not athletes, not somebody who fell down a flight of steps, there's no history of a trauma, and you're having shoulder pain every day, and you're finding that it's worse at the end of the day, which happens to coincide with the end of your bad posture all day long at work, that the rotator cuff tear, or sometimes I've seen micro tears due to repetitive action, or the torn labrum. I quite frankly find that a lot of those diagnoses are superfluous to what your real problem is, quite frankly. So again, I'm a chiropractor, so that's my focus. And so yes, you can have, of course you're going to have therapy after rotator cuff surgery. In fact, the doctor is going to recommend physical therapy first. And again, what we find here is most of our patients have already done all that. They've been to the physical therapist. They've done the 6 to 8 week plan. They've come in 3 times a week, and they've been helped with their range of motion as it pertains to the surgery. But what if your problem was actually that your neck was out of place? Or what if your problem was that your shoulder was frozen because that's just your body's defense mechanism in an area that's been damaged? So yes, you can have chiropractic, you can have stretch therapy, you can have corrective exercise. You should have these things if you're still having a problem following a surgery. So I know that covered it. Thanks for the question.
Okay, so we're continuing with our stretching session here. Sandra's going to be finishing up in just a second here.
It's very intuitive, so I have to feel my way through this. I'm sorry for the lack of words. Go ahead and lift your arm for me and let me know. How does that feel?
So you guys want to go ahead and get set up for a Redcord demonstration too, and Cassandra can continue to do her thing.
Here and here while they set up for that.
So I'm just going to keep talking over while they get set up, just because that's what I do. So you have four muscles of the rotator cuff. So if you're somebody who's diagnosed with a rotator cuff tear or a micro tear, and the 4 muscles are the supraspinatus, that's probably the one that you've heard of. It's the one that runs over the top of the shoulder. It's the one where if you're having this range of motion problem where you can't get any higher than perpendicular, or parallel to the floor rather, if you can't get higher, that's the supraspinatus. You also have the infraspinatus, the subscapularis, and the teres minor. All 4 of these muscles originate from the scapula, from the shoulder blade, and then have attachments out into your upper arm, the humerus, and allow mostly for this internal and external rotation of the arm. These are very small muscles. So it would make sense that if you were someone who was physically active, these smaller muscles, you might have an overuse injury, similar to, everyone's heard of tennis elbow or plantar fasciitis. And by the way, if you have questions about either one of those, I can give you the quick fix for that as well. So the Redcord therapy allows Mike and Sam to isolate that muscle. So you've been diagnosed and you've been told that you have a partial tear of the supraspinatus. That's a very small muscle and difficult with traditional exercise to isolate just that muscle and work on strengthening just that one spot, whether it be post-surgery or not. And the Redcord allows you to do that. So I think Mike and Sam have in mind they're going to go ahead and show you some exercises they use to for the stabilizers and strengthening of the rotator cuff around the shoulder.
Yep. So typically after we get clients stretched out and released and the tissue calmed down a little bit, we'll go ahead and activate all the muscles. Redcord offers a unique way to do that. Like Dr. Lambert was saying, we can really target specific muscle groups. The ropes are neat. They provide 360 degrees of instability. So that forces your body to do a lot of neuromuscular control. That helps your brain kind of retrain those movement patterns and helps us correct the underlying issues and target the problem areas. So we're going to get Miss Lori set up on the Redcord system here. So she's going to hop on the table, put her knees on the pad.
Okay, so knees on the pad, facing out. Go.
And we're going to adjust the sling height here to the top of her shoulders. Good. And then we're going to slide this arm in, right to her forearms here.
Let's get that one in
Yep.
there.
And
There
then
you
we'll
go.
slide the other. All right, so what we're going to instruct the patient to do is to bring your arms out in front like this. Elbows are going to be straight. She's going to slowly press into the slings and extend her arms above her. Yep, just like this, keeping the core engaged the whole time. She's going to try to get her arms up to her ear level. We're going to pause, push into the slings, and then return back to the starting position. She's got a little bit of trembling going on here, which is a good sign to see. It means she's really trying to work hard and target these shoulder muscles. So we're going to rep this out for about 6 reps. So go ahead. Core's engaged. Pushing into the slings. And back to the starting position. Good. So let's do 2 more repetitions. Imagine your hands are going out on rails, pushing straight ahead. Arms to ears. Good. And then back to the starting position.
Now, one great way you can modify this and make it easier is if she's having issues where she cannot stabilize herself and we see the back start to arch, which is what we don't want to see, we can give her a little bit of support using a bungee system. So this would go around her waist like this, and it would connect to the second Redcord system right here. And until she gets strong enough, she now would have a little bit extra support and be able to come out a little bit further. In Lori's case, she's able to do it, so we're not using the bungee at this time.
Good. All right, we'll try one more set here. So she's going to extend out into the slings. Try to keep your shoulders near each other. Good. Core's engaged. Press back to the starting position. And one thing as a practitioner, what I can do to make it harder is to give her some little vibrations in the ropes. So she's going to extend out. And we could add some shakes or vibrations to the rope, which makes the exercise a little more challenging. And then come back to the start. Good. So she's going to rep this out again. So push into those slings. Tap on the ropes here. And back to the starting position.
Try doing that with a dumbbell at home if you think you can replicate this.
Sure. We're going to do 2 more reps. Core engaged. Press. Return to the starting position.
So we use this Redcord system very often for a lot of rehab patients, clients, and we also use it for sports training. Golf, we've used it for that. We've used it for tennis. So it's very versatile and it's very quick results as far as core strengthening goes.
That's a good introduction to our Redcord system.
Do we have any more questions about that treatment?
I'm having a hard time finding. I cannot read the monitor over here either. Maybe some of it. Yeah, I can't read. Does anybody have it on their phone? I can't read that on that monitor. Maybe from here. So I might get that for us. Let me also remind you.
It's a question from Zori.
Okay, tomorrow's Super Bowl day, right? It's 12:25. Medical Fitness and Wellness is open on Saturdays. And a lot of people have trouble getting in during the week with your work week. We are here on Saturdays. We're here on Fridays till 7 o'clock. We make it available to work around your schedules.
All right, so I got Zori's question here. It says, what do you recommend us doing while at work to get some relief from angling your body towards the computer, etc., when it starts hurting your wrist, neck, etc.? So maybe a good posture question.
Yeah, so, right, so this is This is posture. This is what we're doing. In this case, we're talking about ergonomics. So you're at your work desk, and pay attention because this is a $1,000 value here, right? So picture yourself at the work desk. When you're the typical posture is to have head up, standing up. You should have a forward curve in your low back and a forward curve in your neck. This is right in the chiropractic wheelhouse. But you're spending 6, 8, 10 hours a day in your work environment, which means you're plopped down in a chair with your computer in front of you. So the first thing that happens when you sit your big backside down on the chair is that your low back flattens out. You know that good office chairs and almost every automobile made nowadays has that lumbar support built in. The whole idea for that is to maintain some curve in your low back while you're sitting. However, that is nowhere near enough to actually make a change. When you're in the chair, you're flattening out your low back. And a lot of you probably notice is if you're having back pain, the big deal is trying to stand up again, and that's when you have to grab hold here. You'll try and get back up into a standing position. The muscles that attach to your pelvis is called the quadratus lumborum. That muscle tightens up because your body doesn't like this. Now, while you're in the chair, the big muscles are all supported and relaxed. It's when you go to stand up that your brain recognizes, hey, dummy, you're doing something wrong there, and tightens up those muscles with the back pain. So the answer to that, of course, is just spend as little time in the chair as you can. Standing desks are becoming very popular. Getting up and taking breaks. If you're someone who's on phone calls, just make a point of taking your phone calls or every other phone call up and pacing around a little bit. Get out of the chair is the easiest answer. And then the other idea, and even more important, is when it comes to the neck, again, you're supposed to have a forward curve. Far too many people are working at their desks or even have jobs like mine where you're head down all day long, and you want to take your screen monitor and just move it up a couple inches. And then next week revisit and move it up another 2 inches. And get to the point where you're at least neutral or maybe even chin up a little bit looking at your screen, which will feel weird, but you'll get used to it and your neck and shoulders will thank you. Because again, getting back to the cause of shoulder problems, if you're one of those who's having the tightness and tenderness at the end of the day, or the pain going down your arm and into your fingers, numbness and tingling in your fingers, it's from having your head forward, having a misalignment issue, and then exacerbating that by having your head forward at the computer. So again, if you're having those kind of symptoms late in the day, so get the computer screen up, get out of the chair as often as you can. There are other things too. Those are the two simplest approaches to working with your work posture. Okay, thanks for that question.
Good. Yeah, good question. Any other questions we have before we wrap up today?
All right, we certainly appreciate you spending the half hour with us. This is something we're going to try and do each Saturday. Get on Facebook, send us a little question. We'll address it next week. And again, if any of this stuff is ringing true for you, and you want to come in and just talk to us one-on-one, we're in Johns Creek, Georgia. Just give us make contact with us. You're welcome to come in here. We'll do a 30-minute consultation, all four of us if you like. And what I will guarantee you is we might not be able to help your specific condition, but I'm going to do my best to tell you what's wrong. And you're not going to get a version that's just because I'm a chiropractor. I'm going to diagnose and find out what's going on with your shoulder, your low back, your knee, your ankle. There are lots of things you don't necessarily associate with chiropractic, but you might still associate with posture and ergonomics, and we can answer those as well.
One more question.
Okay, all right, one more question.
Looks like somebody.
Sam's going to be our reader.
What up here?
Hang in there, folks. This might be the one for you.
It was Zori. She said thank you.
Oh, it wasn't a question. It was a commentary. Thank you. Thanks for your questions. All right, Mike, you want to go ahead and take us out?
All right, guys. Thanks again for joining us. Like I said, if you have any questions, you can always watch the recorded feed. And like I said, if anybody that's interested in the Redcord that wants to try a free demo, we offer that. Shoulders, lower back, we've done pretty much all kinds of rehab on it, so it's always here and available. Visit our website, exercise4prevention.com, or give us a call, 770-623-4078. But for myself and Sam and Cassandra,
Thanks, guys.
thanks again. We'll see you next week.